to talk more about the situation in South Africa. Let's bring in Emsie Ferreira in Cape Town. Emsie, first of all, talk us through what restrictions have been brought back into place.
Well, those are the two big new restrictions that were announced last night. The reintroduction of the ban on alcohol sales and the return of the nighttime curfew. That kicks in this evening at 9 o'clock. Between 9 o'clock at night and 4 o'clock in the morning, everybody's confined to their homes again. The alcohol sales ban came into effect last night. So this time it was introduced without warning, probably to prevent a rush on liquor stores and long queues, as we saw last time when it was introduced, to carry a high risk of transmission. So it's a very unpopular move, of course, particularly with the business sector and in regions like the Western Cape that's so reliant on wine sales. But it's not entirely unexpected, because after the earlier alcohol ban was lifted last month, there was a surge in admissions to trauma units as people were coming in with injuries relating to alcohol abuse. So there was a study done by the Medical Research Council which showed that if an alcohol ban is brought back for 8 weeks, and of course now it's been brought back indefinitely, but for that time period, 50,000 hospital beds would be saved for coronavirus patients instead. So the president would have been moved by that study and also by political calls from the provinces that are very badly affected, like Gauteng. Gauteng now has 98,000 cases. We expect this to surpass 100,000 today. And we've had the premier of the province say that as they reach the peak there, they're still short 8,000 beds. The same applies in the Eastern Cape, where there's a dire shortage of hospital beds, and that's the province with the third highest incidence in the country.
Now, Emsie, despite those high numbers, this is still not a full lockdown that was put in place. So why did the president hold back on that?
Well, he resisted pressure, even though there were considerable calls for a return of the hard lockdown. And this is because of the impact the initial lockdown had on the economy. It, of course, drove the economy deeper into recession. And the president referred to that last night when he said studies have shown that it won't have a significant impact on the infection rate here, but it will have a devastating impact on the economy. So he really has to juggle these two imperatives of fighting the coronavirus pandemic and at the same time trying to revive an economy. So what we saw last night was he yielded to the minibus taxi industry that had been pushing to be allowed to carry full volumes. And that's, of course, the main form of transport for the working class here. What they're doing instead, because government simply cannot afford to pay people on furlough. It doesn't have that kind of money left in the coffers. So what we saw instead was, focus on mitigation efforts. It's become absolutely mandatory to wear a cloth mask at all times. It spoke about ventilation, sanitation, and the government's need to procure another 12,000 health workers because it's also facing a shortage in that regard.
Emsie, thank you for that. Emsie Ferreira there from Cape Town.